Hello, and welcome to the Well Beyond Breast Cancer podcast. I'm Shira, a breast cancer Previvor, and your host. This show shines a much-needed light on what comes after diagnosis, the side effects, the recovery, and the real-life journey of feeling like yourself again. Each episode brings real stories and expert guidance from oncology and rehabilitation professionals so you can better understand and manage side effects and truly live well beyond breast cancer. Thanks for being here. Hello, everyone. Today we are joined by Skigen, a physical therapist and certified Pilates instructor with decades of experience helping others heal through intentional movement. After testing positive for the BRCA gene mutation, Aura underwent prophylactic surgeries to reduce her cancer risk, a journey that deepened her perspective as both a healthcare professional and patient. And a little extra about Aura, she is my cousin. So this episode is going to get emotional. Aura, welcome.
Hi, how are you?
Good. It's so good to have you here. Now, just before I get into the questions, we actually talked about your journey when I was doing Instagram lives. And I feel like that was a rehearsal. That was about a year ago. I think we're good. We're set.
Yeah.
It's totally fine. We're going to be great. So I'm just going to dive right into the good stuff, to the deep and mushy stuff. We both carry the BRCA1 mutation. Can you take me back to when you first found out and what that moment felt like to you?
So I'm going to give you sort of the elongated version because it's
Yeah.
really, I find that the most amazing part is I was finishing up my clinical fellowship in New York City, and this was 2001. And I befriended a girlfriend. She was at Mount Sinai, and she was getting her master's in genetics counseling. And we had her over at my aunt's apartment for Passover. And we're talking about genealogy, just family and everything. And she mentions, hey, you guys are talking about all this cancer in your family. There's a new gene mutation that we've discovered that we're looking at, and it's called BRCA. And given your family history, you might want to get tested for this. So this was 2001. I was a senior in college, and breast cancer, all of that was, I knew that my grandmother had it. I knew that my mom's first cousin I think she had been diagnosed also at the time for breast cancer. So I knew that it was around, but, my mom was like, okay, I'm getting tested. So about 3 years maybe afterwards, she was tested. She came back positive, and that was like a oh shit moment, excuse my language, but it was, pretty intense. Um, through her journey first, it was, hey, let's just watch you and monitor and all of that stuff. And I was told, don't worry about this, get married, live a life. I wasn't thinking about getting genetic counseling anytime soon. Fast forward to 2008, 2007, somewhere around there. So right after my husband and I got married, before we started on having kids and that journey, I did get tested, and simple little spit test right in the doctor's office. And I found out that I was also positive. So that was a shocker because it usually might skip a family generation. So the fact that I was positive, that my mom was positive, that her mother had been probably positive as well, it was definitely a shocker. I took a lot of deep breaths. I was 34, 33 maybe around the time. We had not started having kids, and the surgeon said, hey, have kids. This is the best thing you can do for yourself. Live your life. Nurse, having all that estrogen is actually good for you. That's what we're finding. We will monitor you. And these are your chances because your grandmother didn't have cancer until later on in life. We don't have to worry. And again, at that time, though my mom was a positive carrier, she hadn't had breast cancer yet. found out that she had breast cancer when my son was about 4 months. When Max was 4 months, he's now 14. And that's the tissues. She's fine. She is healthy, knock on wood, but knowing that she was just diagnosed with breast cancer in her 60s, that probably gave me a little bit more of to do something sooner than later.
Sure.
So that's sort of the elongated story of when I found out that I was positive and the steps towards.
That's crazy that you had a friend that was like kind of at the head of all this, that
Yeah.
was, I mean, not saying she found it, but like that she was in it. She was learning about it as it was happening, as it was coming. That 2001, that's a long time ago.
Yeah.
And it's crazy.
And so it's and it's my mom who called everybody in the family and was like, hey guys, we all need to be tested. And so like rapid fire, I think our parents all started to get tested. There's a lot in that generation.
It's funny because I found out from another family member in my immediate family that I should get tested. My father, who is part of that line of that's how Aura and I are related. Aura's mother and my dad are first cousins. And usually when I say that I got it on my dad's side, it's always like, wow, that's interesting. More times than not, it comes from the maternal side, and it's just very interesting. So it's interesting how, how while Aura and I are kind of part of the same generation, our experiences kind of were very different. And, being a part of the same family with that same gene kind of just hanging over our heads, it's just interesting how it impacted us and impacted our families in different ways. So my next question for you: living with a known genetic risk is very different from a surprise diagnosis. How did that knowledge shape the way you lived your life in the years before surgery?
I wasn't worried. I had an amazing breast cancer specialist that I was working with. I ended up not having my surgery from her, but she was like, hey, this is a matter of fact. Take some deep breaths. Again, you're not getting cancer anytime soon. She's like, you have this marker. You will not get cancer in your 20s, probably not your 30s. She's like, probably not your 40s. Again, it was our grandmother who had it. My grandmother had it when she was probably in her late 40s. So she didn't make me feel anxious that I was on a time limit. She said, listen, by your 40s, though, when you're done having kids, that's when you should think about surgery. And again, I was monitored every 6 months between going through my OB, then going to my mammogram and my breast MRI. So those are the things that I had about every 6 months on a rotation. And I actually felt comforted knowing that I knew what the possibility was and that I could do something about it in the future.
It's funny. I remember talking to you like when I found out I don't have tissues, when I found out, and it was interesting because you talk about how it was a matter of fact, how your doctor approached it that way. That was how you spoke to me. You're like, yeah, I have it. You have it too. Like, makes us closer. This is this is what I'm thinking of doing. This is what I'm planning. I think you most definitely had one of your kids, I think. I don't know who.
Yeah.
But you had talked about your experience, and it was a very calm experience where, some doctors, like your doctor, are very calm about it. Some are a little bit more aggressive about it. So I think sometimes it's also helpful to get a second opinion in that case, so you're not rushed to make decisions. Maybe you do need to make the decision right away. I'm not telling anyone they shouldn't, listen to their doctor, but second opinions are always really helpful in that case, because you just want to make sure that you're doing it at the right time that's right for you. So choosing preventative surgeries is a massive decision. as we all can agree upon. What ultimately led you to say this is the right time, and what factors weighed heaviest for you?
We were done having kids. That was number one. And even being done having kids, like I chose my first surgery. The breast oncologist probably would have said she wanted me, get your ovaries done first because there is no golden test, standard test to diagnose ovarian cancer. Like they don't diagnose it until you have it. And once you have it, it's horrible. And so she said, first do that and then worry about your breasts. I went the other way. I had had
You
two
didn't
kids.
listen. You're like,
I didn't
and
listen.
thanks, but no thanks.
Because though I was approaching 40, I wasn't, in the back of my head, I was like, well, maybe we'll have a third. I don't know. I'll put it out there in the universe. But I had had two kids, had two C-sections, boobs had totally deflated. I mean, they were flat pancakes. And I was like, you know what? I'm ready for good boobs. That's pretty much was my first surgery because of that. I was like, I want boobs. I want boobs that aren't flat. I want them nice and perky. And let's start with that. And so that to me was very manageable. I had a minor, I don't want to say complication, but this is very interesting for whoever might get a breast surgery in the future. I had had really bad mastitis twice on my left side. The surgery, I had had a breast lift first. So first they did a breast lift. Then a few months later, that's when I was supposed to have reconstruction. It was supposed to go direct to implant. When they put the implant in, they found out that I had decreased blood circulation on one area of my breast, which afterwards I said to the surgeon that happened to actually be where I had really bad mastitis.
Mm-hmm.
So I would say sort of throw it out there to the doctor. I thought it was very interesting that the one area that it was a really bad blood flow was the area where I had really bad cases of mastitis.
Interesting.
And so I didn't go direct to implant. I had to do an expander. So my surgery took a little bit longer because of that. And then when I got out of surgery, I was totally flat. And that that was a shocker because I was not expecting to see that. And I think no matter how strong you are, want to be like seeing your body in a totally different state is very altering. And I had two C-sections, but that was different. I had given birth to two beautiful little boys. So that was shocking. And then it was like 4 months later that I had the expanders put in. The implants, I'm sorry.
Interesting. The Previvor journey isn't always as visible. Where do you think your experience differs from traditional breast cancer narratives, and where do they overlap?
You're not sick. So if you want to tell people what's going on, that's up to you. And I'm not public about it now, but I'm happy to talk about it. Whereas some previvors are now more on Instagram or on Facebook, and they're talking about their journey because they want people to see that it can happen to anybody, and like this is a positive step. I wasn't that way. Instagram, Facebook, it wasn't that thing. I also wasn't really comfortable showing everything pre, post, but I'm taking the steps to prevent from getting sick.
I mean, that's why I think a lot of people, I mean, especially for me, I know that through my Instagram, I would say at least 30 people have DM'd me and said, if not more, because of you sharing your journey, I went and I got tested. And some of these people are not necessarily, 20 years old. They're, older, they're more mature in life, and they just want to be ahead of it.
Right.
From your perspective as both a patient and physical therapist, what does recovery from a prophylactic surgery actually look like that people aren't prepared for?
I wasn't prepared for how intense it was. Emotionally, physically, like I gave myself 2 weeks of not working and then I was back in the office. Like, I think I was still under some anesthesia. I mean, it was crazy. I was working. I took 2 weeks off and I came back into the office and I still had drains. So I was wearing a button down shirt. I had a fanny pack that I was putting the drain bulbs in. And I said, okay, I can't do a lot of manual stuff on you, but this is what we can do for physical therapy. And I was like, what was I thinking? Like, but I did it. I should have just rested more, but that's not also my personality. But it's intense. It's more emotionally intense than I think even the physical aspect, especially again, because I had the expanders in and I didn't go direct to the implant. So it was a little bit longer until I got the bulbs removed. Yeah, it's just the emotional aspect of like you for me where I was so flat for so long before they could actually expand.
Yeah, I can't believe you took 2 weeks off. That's nuts, Sora. I was like at it. I mean, granted, we had different surgeries, but like I was out of commission for like a good 2 months. Like I was, whoa. I mean, and even if I think of just like the half part of just the preventative double mastectomy, like
Right,
I am,
right.
pain is not my game. So
I did the same for when I had my ovaries and tubes removed. Again,
that's nuts.
I was maybe off for like 2.5 weeks or something. I didn't give myself, even as a therapist, like I did not give myself enough grace to say, I need to sit on my butt and do nothing. So if you are a doer, like I'm a doer, tell your spouse, tell your support system to keep reminding you to sit on the couch and do nothing because every day I was like, oh, I should walk a little bit more. Oh,
Mm,
I should maybe do a little bit more. And I ended up with like a seroma. I ended up with swelling in
no.
my abdomen because I didn't think and I was just doing. So sometimes, as they say, doctors, therapists, we are like the worst patient.
It sounds like it, Aura. I'm not gonna sure it
I was
sounds like it.
horrible. I was horrible. I was bad. Do not follow my lead.
Don't do what Aura
Do
did.
not do what I did.
Do what I did. I did a lot of nothing. I sat in my recliner for a good long time. You've spent decades helping people heal through movement. How did Pilates and intentional movement play a role in your own recovery process, if at all?
When I would stand, I would think about how my posture is, where's my rib cage over my pelvis, like certain little cueings that I use for just my regular patients, both Pilates and physical therapy, and just thought about my breathing, especially deep breathing, feeling that entire rib cage move because again, we're having drains on either side of our chest. Like
Hmm.
we don't want to breathe. We don't really want to move. We don't want to lift our arms. So taking the time, I did take the time to focus on breathing, focus on just little movements of the spine, doing just gentle side bending, just very gentle movement and walking. So that helped. And then with with the tube and ovary removal. Again, should have sat for 3 weeks and I didn't, but just starting to gentle like leg movements on the reformer, just getting that pelvic tilt, getting that core and the pelvic floor to start to fire again slowly. So that I used all of those techniques for healing. Should have
In the
done, and also like eventually when I was able to do some scar mobilization too, I did that around the breast line as well as the abdomen.
Do you think that when you were doing those, were you, how do I say this? Did you push yourself during those exercises or did you take it easy on yourself?
Those I took it easy.
Okay.
Yeah.
All right.
Because I think I had realized that I really shouldn't be pushing myself.
Okay. All right. As long as you
I learned from,
realize.
yeah, yes, yes, for that, I took it very easy. And that was like, you know, 8 weeks, 2 months post op that I started just doing that.
Okay.
I learned my lesson after the doctor had to remove a lot of fluid from my belly. He said that
That's
was
good.
bad.
I'm glad you learned that lesson, because I remember when I got my tubes taken out, and was it that I did that, and then I did the breast lift and reduction. And I
Mhm.
didn't have as many markers, so I didn't have as many drains and all that kind of stuff. So I was trying to push myself. I was making an aura move. I was, like, I remember I walked from like 89th to like 80th Street, and I was huffing and puffing. Like I was, and I had to get into a cab because I had to go back home. Like it was so much for my body. And this was like a week and a half after surgery. Like, what's six
Right.
blocks? Like, what's the big deal? Like, woohoo. But your body is a wonderland. It's got lots
Yeah.
of things that you don't even know
Yeah.
about.
Yeah. I mean, and sometimes you just have to be like, shoot, I should not have done that. And then like
Yeah.
learn your lesson. Yeah.
And do it the right way.
Right.
So you kind of talked about this a little bit when you talked about your surgery, when you saw yourself flat. But preventative surgeries can change how someone feels about their body. How did you navigate that shift, and what helped you rebuild confidence and connection?
I have a great husband. He's fantastic. It's going to make me cry too. I mean, he's always like, he was the most encouraging person and see what my mom went through with her breast cancer diagnosis and treatment. And he was like, babe, I want you around. We'll do whatever you have to do. And he was very supportive, very supportive. And so that's number one is get people around you that support you. It doesn't have to be, I mean, if it's your spouse, if you're married, that's wonderful. If not, it's your parents if they're alive or your best friend. Having a support system of some type is extremely important. Just to tell you like you're beautiful and you're going to make it through this. And again, I knew that the flatness was temporary, but it was still like, oh my God. And so I would realize in my head, I'm like, okay, this is temporary. This sucks right now, but it's going to be fine. Like I just had to like tell myself. So that helped. That like
Support
mantra.
and that support system is everything. It's huge. My support system was my boyfriend of not even a year at the time. Now he's my husband, but like
Right.
how he stuck around, I was like, "You sure? Like, you sure you want to do this? This is crazy." But he did, and you just finding a best friend, whatever it is, because you need to be able to tell that mantra to yourself, but also hear it from somebody else, because it then impacts even more. Where do you feel the medical system falls short in supporting women with BRCA mutations, especially when it comes to rehabilitation and long-term quality of?
Well, it's funny. I just took a physical therapy course this past weekend. It was on myofascial release, like very gentle myofascial release. And we got worked on by the instructor. And I had mentioned to her that I had prophylactic mastectomy. I also had an abdominoplasty and the ovaries and tubes. So she was like, great, I want you to be my patient for we do the abdomen. And like, even as a physical therapist, we are so trained to touch the shoulder joint, the neck, the back. Like, we're not taught, like, she literally put my hand on my boob. She put her hand on top and started, like, sorry, as I'm doing this, moving my implant around because it was just, I have still tight, I get tightness. And so I was like, shoot, I need to like start going to every single doctor and be like, because I have a lot of patients who've had breast cancer. So they still have the scarring from the surgery, usually the lymphatic system through the armpit, or they've had chemo or they've had radiation. They're like, oh, but that was then. I'm like,
Mhm.
but it's not. It's
Mhm.
still now. Like you still can get recurrent tightness as OBs, they need to go in too and start discussing like, okay, what is your medical history? When did your mom go through menopause? Did you have any cancer? Let's get a full workup on, HRT. I had to go on HRT. I'm
Mhm.
a huge, if you are able to go on it, then go on it. I had a miserable year without it. I was on it, and hands down, I'm like glad that I'm on it. We need to start being more open with our providers and having those conversations from the get-go. So if you're a mom to a young teenager, go in and start talking to the OB, talk to your doctor, primary doctor about your medical history so that they can start appropriately caring for your child.
I think that's very well said. I feel like I just went to another panel where they were talking about HRT, and that's hormone replacement therapy for anyone that's listening that is not aware. And she was talking about her experience, and I was like, oh, okay, good to know. And you're the second person I've heard HRT talked about a lot recently. It's,
Yeah.
I guess
Yeah.
it seems like if it's right for you, then you should
Right.
definitely go for it.
Right. And even again, I'm BRCA positive. I'm on HRT. Like, I mean, so if you have the prophylactic surgery and you're cleared by, and there's no reason why, unfortunately, even your general OB doesn't know if you should or should not go on. So I've been listening to a separate podcast. I won't talk about that, but like really start learning the information for yourself, because a lot of OBs are still in the should I not? What happened? What if something happens? So
Well, I
start
think
getting knowledgeable on it.
to that point, I mean, not only knowledgeable, you are your best advocate.
Yeah.
And so the more
Yeah.
knowledge you have, the more you can push forward. And even if your doctor says no, that's where that second opinion comes in.
Right. Yeah.
Don't question yourself.
I
Question.
mean, I was given my OB said, "Do you want to do HRT?" I mean, I think I was almost clinically depressed. Like it was bad. It was very bad the year after my surgery. Because I went about a year and 2 months without any hormones. And it was a shock to my system. I mean,
Mm,
imagine having all of these hormones and all of a sudden one day being like, "Nope, there they're
yeah,
gone." And my OB said, "Do you want HRTs or do you want what is the antidepressant medication?" I was like, why is this a question? Like, what was removed. I don't care if I have to spend a little bit more a month. Like, I want those back in my body. Like, that's what
right,
I need.
right.
Yeah.
It's a very important conversation that everyone should be having with their doctor. So I have two more questions for you. For someone who just found out they carry the BRCA1 mutation and feels overwhelmed or scared, what would you want them to know about their options, their strength, and their future?
First, take a few deep breaths. Like, life is not going to end immediately. That's number one. Like, this is not a death sentence. This is actually the most amazing thing that could happen because you were just told what to do. Okay. Like I give this as like the most amazing open playbook because you now have control. You have absolute control over the situation. Go go to your first, probably your primary care, you were diagnosed, or through your OB. Through them, go and get recommendations to a breast oncologist, and to and start looking at your family history. Ask questions. Ask family members who had cancer, what kind of cancer. Again, you know, male males who carry BRCA tend to get, I believe it's prostate
Prostate.
cancer. So look about your family history from both sides, mom's and father's side, and ask questions. And then start to, again, taking deep breaths, talk to an oncology specialist and say, this is what my family history is. What do I need to do? And sometimes it might just be monitoring for a while, depending on what life stage you were. Like, again, I was in my 20s when I was diagnosed, and it was 6 months. Every 6 months, I saw my OB, and every 6 months, I had a breast MRI and a mammogram. So she was watching me. Like, find someone that you feel confident in to be your person. And then when you both establish that this is the time in your life where you need to do something, then you have the tools.
It's a really nice answer. I like that answer. And that it really is, you've been told what to do if you have this gene. If you find out, you're given a roadmap, or you're going to figure out the roadmap. You're not completely lost. So, Aura, I ask all my guests this question, and hopefully you'll be able to answer it. What does living well beyond breast cancer mean to you?
Just taking care of your health. Again, knock on wood, I never had breast cancer or never ovarian cancer, but taking care of your health. Like I think that's all we can do is take some, and taking some deep breaths, going for walks and staying healthy in your diet. Again, I tell my primary care, he laughs at me. I'm like, I'm an 80-20 girl. I was like, listen, I'm 80% good, 20%. Like my neighbor brings over donuts.
It's a
I was
great
really
neighbor.
good. I just had a donut. He was a great neighbor. He brings over way too many treats. But yeah, like enjoy the pleasures in life. And I think, we know what is bad for you or what not to have too much of, you know. Do I still drink wine? Yes. Am I drinking it every night? Absolutely not. Like, do I watch the amount of cocktails I have? Absolutely. Because I know all of those things just are a little bit more of a red flag than what they used to be. I exercise daily. I need it for my mental sanity. Again, I have two teenagers. So like that's well beyond breast cancer for me is just staying healthy and knowing that I have control over the story of my life.
Beautifully done, Aura. Beautifully done. Cousin, it was so great having you on the podcast. Thank you so much for
I love
taking
our
time.
talks.
I love
Yeah,
our talks. They're always tears. It's the cousin way. We're
it
clearly
is.
related. It's nice to always see someone else crying besides me or hear someone else crying besides me.
Oh, yeah.
But everything that you said during this conversation is so important. And I hope people hear it, especially from a Previvor perspective, which is so important to also talk about. So, Aura, thank you so much for joining us. And
You.
everyone out there, thank you for listening. And we'll see you again soon. Thank you for joining us on the Well Beyond Breast Cancer podcast. If today's conversation moved you, please subscribe and share it with someone who may find it useful. We'll be back next month. Until then, keep advocating for the care you need. Your quality of life matters.